Bismillahirrahmanirrahim. Assalamu alaikum dear viewers. I am Professor Dr. Muhammad Usman, and in this video we will discuss the functions of thyroid hormone. And it is one of the most important hormones in our body, which is secreted from thyroid gland. So this is the second lecture on the thyroid series. In the first lecture we discussed its synthesis, and in the next lecture inshallah we will talk about its abnormalities. So thyroid has wide variety of effects in our body. It has effect on the metabolism, and regarding metabolism, it not only affects the basal metabolic rate, but it also has effect on the carbohydrate, fat, protein and vitamin metabolism. So let us discuss these one by one. Now normal quantities of the thyroid hormone, they are required for normal metabolic rate. Okay, normal BMR is maintained by the normal quantities and normal secretion of thyroid hormone. But when the secretion of thyroid hormone is increased, for example in hyperthyroidism, then the BMR can increase from 60 to 100% above normal. Thyroid hormone increases the oxygen consumption of almost all the active tissues in the body except in the brain, anterior pituitary, uterus, lymph nodes and testis and spleen. So in these tissue it does not increase the oxygen consumption. Now thyroid increases the BMR by increasing the size, number and activity of the mitochondria. It causes the cell membranes of most of the cells to become leaky to the sodium ions, and it also increases the activity of sodium potassium ATPase pump. Now as you can see in this graph, normal levels of thyroid hormone, they maintain the normal basal metabolic rate or BMR. But when the thyroid hormone secretion increases, then in case of hyperthyroidism the BMR increases above normal, and in hypothyroidism the BMR it decreases below the normal levels. Now there are certain effects which are secondary to the increased thyroid hormone secretion in hyperthyroidism, and they include increased urinary excretion of nitrogen, potassium, uric acid and urinary hexosamines. So as you can see in this figure, the thyroid hormone, it increases the number, size and activity of the mitochondria, and it also increases the activity of the sodium potassium ATPase pump in all the tissues of the body. It has effect on the carbohydrate metabolism. It stimulates literally all aspects of the carbohydrate metabolism. It not only increases the rate of glucose absorption from the GIT, as you can see in this figure, but it also increases the glucose uptake by the cells. So then it increases the glycolysis, increases gluconeogenesis, and it even increases the secretion of insulin from the pancreas. So that is why we say that it increases all aspects of the carbohydrate metabolism. Similarly, it also increases all aspects of the fat metabolism. It increases lipid mobilization from the fat tissue. Okay. Then due to this it increases the free fatty acid concentration in the plasma, and it also increases the oxidation of free fatty acids by the cells. A very specific effect is that it increases the number of LDL receptors. Okay, it increases the number of LDL receptors in the liver, leading to the rapid removal of LDLs from the plasma by the liver. So it decreases the concentration of cholesterol, phospholipid and triglycerides in the plasma, and it also decreases the level of cholesterol by increasing the cholesterol secretion in the bile and excretion in the feces. Now its effect on the protein metabolism is that its normal quantities are required for the normal protein synthesis, and in normal physiological quantities it is anabolic hormone. But slightly increased secretion or quantities of the thyroid hormone, they produce a catabolic effect, and in hyperthyroidism there is excessive protein breakdown. Then its effect on the vitamin metabolism, because this hormone increases basal metabolic rate, so it also increases the need for various vitamins, and a relative vitamin deficiency has been seen in the hyperthyroidism. It also converts carotenes to vitamin A in the liver. Then its effect on the growth, this is the next function. In the first function we discussed the effect of thyroid hormone on the metabolism. Thyroid hormone has both general and specific effects on the growth. General effect is that it increases the functional activity throughout the cells of the body, which helps in the growth of the person. Specific effect is that it is necessary for the growth hormone to cause normal growth. Now you know that growth hormone is a hormone of anterior pituitary and it is responsible for the growth, but it cannot cause growth in the absence of thyroid hormone. So this is called permissive action of the thyroid hormone. So it next is the effect on the GIT and body weight. It is the third function of thyroid hormone. It increases appetite and food intake. Okay, it increases appetite and food intake. Also it increases the secretion of the digestive juices and it increases the motility of the GIT. In hyperthyroidism, there is often diarrhea and decrease in the body weight, while in case of hypothyroidism, there is often constipation and increase in body weight. A very important effect of the thyroid hormone is on the cardiovascular system. This hormone increases the heart rate and force of contraction of the heart. So it increases the cardiac output and it may increase cardiac output 60% or more above normal in hyperthyroidism. It increases the proportion of alpha myosin heavy chain in the cardiac muscle. Then in circulation, it also increases the blood flow because this hormone increases BMR. So more metabolic end products are formed which cause vasodilation. So blood flow is increased. It also increases the cutaneous blood flow, as you can see in this figure. So this is beneficial because it serves to dissipate the excess heat from the body which is produced as a result of increased BMR. Then its effect on the blood pressure. In case of hyperthyroidism, usually the mean blood pressure it remains normal, but the pulse pressure, which is the difference between the systolic and diastolic, this pulse pressure is increased, and it is because this hormone increases the systolic blood pressure and decreases the diastolic blood pressure. So in hyperthyroidism, pulse pressure is usually increased. Then this hormone increases the number of beta receptors. So it increases the response to the circulating catecholamines. Then is its effect on the respiration, and as you know, it increases the rate and depth of the respiration. It increases the rate and depth of the respiration, and regarding cellular respiration, it increases oxygen utilization and carbon dioxide formation. Okay, this hormone specifically increases the oxidative phosphorylation in the mitochondria, and as we discussed earlier, it increases the size, number and activity of mitochondria also. Now next is very important effect of thyroid hormone on the CNS, central nervous system, and it has effect during the fetal life, and in fetal life it promotes growth and development of the brain during fetal life and also during the first few years of the postnatal life. If no thyroxine is secreted during the fetal life, the parts of the CNS which are most affected, these are cortex, basal ganglia and cochlea. So respectively, they will result in mental retardation, motor rigidity and deafness in the newborn. Now during adult life also this hormone is very important. It increases the rapidity of the cerebration, although the thought process may be dissociated if hormone levels are increased more than the normal. And in case of hyperthyroidism, there is usually nervousness, psychoneurosis and panic attacks and anxiety, while in case of hypothyroidism, the speed of cerebration is decreased. Then it also increases the activation of reticular activating system, and this effect is secondary to the increased responsiveness to the catecholamines. Then a very related effect is on the sleep, and normal levels they are required for the normal sleep behavior, but in hyperthyroidism the person is unable to sleep. Okay, the person has difficulty in falling asleep. It is because of the excitable effects of the thyroid hormone on the synapses and due to its activation of the reticular activating system. And in case of hypothyroidism, there is extreme somnolence, and with sleep period prolonging to about 12 to 14 hours per day. Now is effect of hormone, this thyroid hormone on the muscles, and normal levels maintain the normal health of the muscles, but a slight increase in the level of thyroid hormone, it can cause protein breakdown. Okay. So, in hyperthyroidism there is protein breakdown and protein catabolism. So, there will be weakness of the muscles. Now, in case of hypothyroidism, a very characteristic and important clinical sign is sluggishness of the these tendon jerks. Okay. The tendon jerks or deep reflexes, these are sluggish. They relax slowly, the muscles relax slowly after a contraction. So, this is called delayed tendon jerks, and this delayed tendon jerk is one of the characteristic diagnostic sign of the hypothyroidism. While this muscle tremor, this fine muscle tremor, which can be tested by asking the patient to stretch his hands and placing a piece of paper or a card over his hands. So, by this maneuver the fine tremor can be observed, and it is a characteristic sign of hyperthyroidism. Now, the frequency of this fine tremor is about 10 to 15 times per second, and the cause of this tremor is increased synaptic activity in the areas of the spinal cord which control muscle tone. So, next is the effect of this hormone on the other endocrine glands. Now, this is one of those hormones which increase the rates of secretion of several other endocrine glands. But having said this, this hormone also increases the need of the tissues for those hormones. For example, it increases insulin secretion from the pancreas, but at the same time it also increases the rate of glucose metabolism in the body. Similarly, as we discussed earlier, this hormone is necessary for the growth hormone to cause growth, and it increases the responsiveness to the circulating catecholamines, that is epinephrine and norepinephrine, by increasing the number of beta receptors. So, this hormone has got a permissive action on growth hormone and on the catecholamines. Now, the last function of this hormone is on the sexual function, and the normal quantities, they maintain the normal reproductive health in males and females, but in case of hypothyroidism there is loss of libido in males, and in females there is not only loss of libido but also menorrhagia, polymenorrhea, irregular periods, and occasionally there is amenorrhea. While in case of hyperthyroidism, in males there is impotence, and in females there is oligomenorrhea, and occasionally there is amenorrhea. Now, something about the regulation of secretion of this hormone. Basically, from the hypothalamus, TRH or thyrotropin releasing hormone is secreted. Now, this hormone acts on the anterior pituitary and causes the release of TSH or thyroid stimulating hormone, which acts on the thyroid gland, and it increases the secretion of T3 and T4 hormones. Now, these act on almost all the tissues in the body, and as a result of their effects, the TRH in the hypothalamus and TSH from the anterior pituitary, their secretion is decreased. So, this hormone regulation, it occurs in a negative feedback manner, but we do not know exactly which effects or which products from the tissues they are going to decrease the secretion of TRH and TSH. Then certain factors like cold, it stimulates the secretion of TRH from the hypothalamus. So, there will be increased secretion of thyroxine ultimately in case of cold, and there are certain factors like anxiety, stress and exercise, they have a negative effect on the secretion of TRH, TSH and subsequently on the secretion of thyroxine. Thank you for watching today's video. Please like, subscribe and share to this channel. If you have any questions, you can ask me on this email address. Stay blessed and Allah Hafiz.